Hello and welcome to this week's staff brief. I'm Paul Robinson. I'm the Chief Executive here at Sherwood, and with me I've got Adam Wisdish, ICS Senior Digital Programme Manager. I've got Mel Butcher, Digital Midwife. We're also joined by Debbie Kisley, our Deputy Director of People, and Vicky Malia, the Head of Culture and Engagement. Adam and Mel will be talking to us about the exciting launch of BadgerNet in maternity. That's happening this Thursday. Before I hand over to Adam and Mel, some general updates from myself, Vicky and Debbie. So firstly, Vicky, it's the 15th of November. There's 10 days to go for everyone to get their national staff survey in. What do we need to do? What do we need to do and what do we need to know?
Yeah, thanks, Paul. I'd like to say it's as an exciting countdown as Christmas, but that's probably not true, is it? But once this one's over, it's then a month till Christmas. So let's do that instead. So yeah, hi everybody, just here to give the weekly update on the National Staff Survey. So great news is that this week we have tipped over our 50% mark. That's really exciting. That means now that we have heard from more colleagues than we haven't heard from, but we would absolutely like to still hear some more voices. So the survey is open for another 10 days. If you've got your survey by email, then you've got the whole window still to complete that until next Friday. If you've got your survey in paper, just to be sort of careful and thinking about the postal strikes, we would really recommend trying to get those back in the post as soon as possible, really. So ideally this week, if not, then certainly early next week. So as an organisation, like I say, we're now sitting over 50%. Well done to UEC and Surgery, who are still sitting in that tussle for top spot of our divisional performance. So both now over 60%, which is fantastic. And then all our other divisions have continued to improve, but just a little lower. If anyone is still having a problem with finding their survey, please do get in touch. It absolutely isn't too late. I can help you find that survey. If you think you'll be getting it by email, just search in your inbox picker and that will bring it up. You'll probably have had quite a few reminders by now if you haven't done it. So you should have a few opportunities to click your link and complete it. But other than that, it really is just to say, we really are very grateful for colleagues who've taken the time, and we're hitting nearly 3,000 colleagues have fed back, which is absolutely fantastic and very much appreciated. And for those who haven't, it's absolutely not too late. So please do share your thoughts. It's a great opportunity to share the good that you see, as well as the areas that where we can do better. And we know there are areas where we can do better. Obviously, if you don't tell us, it's hard for us to work those into our plans. So please feel safe to speak up. I've had some more questions around confidentiality this week. As the person who gets the reports back from our provider picker, I can absolutely assure you that nothing comes back to us that can be traced back to an individual. We don't even get a team level report if less than 11 people in the team have responded, and that is all to protect your confidentiality, your anonymity. So please do be assured that although you are getting reminders, although you might be getting a paper or an email reminder, it is only picker who has that information, who are able to actually link you to a survey. Nothing that the trust gets back or sees gives us that level of information. So yeah, please do have your voice. I know Paul, all of the exec team think it's so important for colleagues to be engaging in this. We do sit and really look at those results and think about how we can support you going forward to improve life at Sherwood.
Yeah, thanks, Vicky. I do think it's incredibly important. It's how I understand what works well here in the trust and what doesn't, and what we need to improve on to support all our colleagues. So yeah, incredibly important for me that as many people as possible takes the 10 to 15 minutes it takes to complete the survey. There's a divisional competition as well, isn't there? So I think there's a star prize of £250. Is that right?
Yep, so every division has got £250 to award to an outstanding team within their division for the survey. This may mean a team that has consistently had high engagement over the past number of years. It may be a team who've traditionally really struggled and have put loads of effort in this year and have got a great response rate. So different teams in different divisions, but £250 up for grabs in every division. And that will be for the team to spend on something for themselves. So we've had teams in the past who've wanted some embroidered hoodies, who might want some things for their staff room, who may want to consider something like a buffet at Christmas time, for example. So it's to spend on you, to thank you for your engagement, and for taking that time to share your feedback on how it is at Sherwood.
Brilliant, thank you. Well, thanks for that. If anybody's got any questions, please place them in the chat. Further encouragement on flu and COVID vaccinations. So we're continuing to encourage everyone to receive their vaccinations, and thank you to everyone who so far has had a vaccination. And we know that over 50% of our frontline colleagues have been vaccinated. So thank you for that. Needed to give a shout out to the diagnostic and outpatient division, who have the highest uptake so far with nearly 54%. So well done to you guys. You can receive a flu jab by dropping by one of the clinics that should be on screen any moment now. There's quite a few, so please access them on the intranet as well. Or you can just drop by the vaccination hub or contact a peer vaccinator. There's one on most wards. They can, and the peer vaccinators can provide flu vaccines. You can also book appointments online for either of the vaccinations. The links will appear magically in the chat, I think. And don't forget, colleagues who do receive flu jabs will also be given a free meal voucher, so more incentives there. And that can be used in the Spice of Life restaurant, and you'll be also entered into a monthly prize draw. So important. We know that flu's on the increase. We know COVID's still around, so it's so important that you get a vaccination, protect yourselves, protect your teams, protect your families, and protect your patients. So really encourage you to do that. Okay, thank you. So it would be remiss of me not to mention last week's announcement from the Royal College of Nurses about the outcome of their recent ballot on industrial action. And I know this has made widespread national news. So many of the biggest hospitals in England will see strike action by RCN members, but others, like ourselves, miss the requirements to qualify for that action. That doesn't mean that we're not affected. Many of our near neighbours like NUH, like Notts Healthcare, are anticipating action within their trust, which we know will have some impact on us, certainly our people, our services, and certainly patients in the area. So from a very practical perspective, while we know that RCN members at Sherwood aren't due to take action, we do know that our services will be impacted, as I mentioned, and I want to reassure you that we're already doing everything we can to plan for that, and we have tried and tested plans in place for a whole range of issues and incidents that ensure that we can provide the best possible care to patients, and this is one of those issues. We work really closely with all our trade unions and staff bodies, and we've already set up a weekly planning group with those and our operational colleagues to stay really close to this issue. And as soon as we know precise dates of action and when they're confirmed, we'll let you know more information. On a personal level, I want to be really clear with you that we value you. We appreciate the work that you're doing. We understand the importance of good pay and conditions for you and indeed for the organisation. And we will do everything we can to ensure you are properly supported over the months ahead. This is the first of many updates I anticipate bringing to Team Brief on this issue over the coming weeks, and we're also preparing an intranet page and loads of frequently asked questions to keep you informed about the latest developments and ensure you are properly supported. If you have any questions, please pop them in the chat. If you have more specific questions, please speak to your line manager in the first instance. Okay, so please ask questions should you need to in the chat. And then lastly, this Friday marks the start of World Antimicrobial Awareness Week. And this week's theme is Preventing Antimicrobial Resistance Together. And you can join us on Twitter every day of the week, where a different colleague will make a pledge to support antimicrobial stewardship. And on Friday, this Friday, the 18th of November, please come along to meet us at a stall that will be in the King's Treatment Centre here at Kingsmill Hospital, where we can engage with the public in conversations about antimicrobial stewardship. And to finish the week, next Thursday, the 24th of November, we'll join other workplaces and light Kingsmill Hospital up blue to bring global visibility to the increasing threat of antimicrobial resistance. Okay, so that's my general updates. I can see a couple of questions coming in the chat, but before we turn to those, I'll turn to Adam and to Mel. Tell us about the exciting news of BadgerNet. And I think, Adam, I'm handing over to you first.
Yes.
Brilliant, thank you.
Absolutely. So everyone, my name's Adam Wisdish. I'm the programme manager across both Nottingham University Hospitals and Sherwood Forest for the BadgerNet programme. BadgerNet is a maternity information system, a state-of-the-art maternity information system that is going to replace Orion in the maternity pathway for staff at SFH. So I suppose the big question is why are we doing this? Why are we moving away from Orion? And I think the first answer to that is because, and I think this is probably clear if you've ever spoken to a midwife, staff want to get off Orion, they want to get onto BadgerNet. It's a much better system. It has it's faster, it's more reliable. It also allows you to record much more information about patients going through maternity than the current system does. Long term, it will also be able to integrate things like EOBS from Nerve Center. It will be able to integrate labs and bloods messages. It will be able to integrate CTG machines. So there's a lot of benefit to using BadgerNet over the current system. It's also better for our pregnant people as well. So the system comes with a fully fledged patient held record, which is an app called Badger Notes, and that app is something that they can use to access their care record. They can access all of the leaflets in their that they've been given by their midwife or their doctor, and they can access to write their care plan and really make a decision about what care they want when, and that can be recorded in a very transparent and easy to record way. It's also better for working in partnership. So as I mentioned at the top, I'm working not only for Sherwood Forest, but also for Nottingham University Hospitals, because this is a joint programme. And because it's a joint programme, we have aligned as much process as possible between NUH and Sherwood Forest to make sure that the standard of care across our county is as good as it can possibly be. And then secondly, it also comes with functionality to seamlessly move patients between Nottingham and Sherwood, so that if you have somebody that might attend a booking appointment at Sherwood, but then come to Nottingham for a scan or for antenatal clinic or for anything else, they can move between the two systems at the touch of a button. And actually, we've only been live for less than 4 hours in Nottingham, because today is the go live for Nottingham, but we've already done that. We've already imported a patient from the Sherwood Forest system into the Nottingham system, which is very exciting to see happen. So I suppose the next thing to talk about is what's happening and when is it happening. So on Thursday is the big day for Sherwood Forest. That's when the antenatal clinic, antenatal wards and community antenatal care will be transferring over to BadgerNet off of Orion. On the 22nd, so next Tuesday, the rest of the service will follow, and that will include everything in triage, everything in the pregnancy daycare centre, everything in labour suite, and the various other parts of the service that haven't gone live on Thursday. We are going to really support the service through this. It's not a kind of put it in and then abandon maternity. We've got user guides and sandbox environments that are happening and have happened over the last few days. We've got loads of floor workers coming in from across the digital matrons team, but also external floor workers, and then they're learning from NUH's Go Live as well. We've also got remote support for community, so we've not forgotten about our community, and there will be in-person support at Newark as well, because obviously this isn't something that just impacts Kingsmill Hospital, but also impacts Newark over in Newark as well. And I also just want to say at this point on the record, a massive thank you to all the staff who have come to their training sessions, because we have 90% of staff trained just before the go live, which is an incredible achievement. And I think a big thank you and a well done to the maternity team needs to be given, because I know they've worked really hard in really difficult circumstances to get that training to that level. So that ends kind of my pre-prepared remarks. I'm happy to take any questions that there might be, and also hand over to Mel if she wants to say anything in addition. But yeah, are there any questions so far for us?
Thanks, Adam. I think we've lost Mel. I think she's just dropped off.
Yes.
That's really disappointing. Mel was going to talk about with such enthusiasm about this as in the same way that you did. Hopefully she'll rejoin us at some point. So thanks for that, Adam. Yeah, how many you may have covered this. How prevalent is BadgerNet across the NHS?
Yeah, so it's the leading system across the NHS. So BadgerNet is in place across 33% of trusts in the country, in both England and Scotland, and that means that we've got the same kind of record in portion from those trusts as we do in Nottingham. So, for instance, if someone comes in from Oldham or Doncaster or from as far away as Devon, they will be able to be pulled into the system seamlessly if they're a BadgerNet trust elsewhere.
That's great, thank you, and that's really important, isn't it? And it's incredibly exciting. It's such a step forward in terms of it's our EPR system, but it's also that accessibility that women will have of their own records and keeping a track of their treatment and their care. That is absolutely fantastic. So thank you for enabling that to happen. I know you're a really busy man today because NUH go live today, Sherwood tomorrow. So thank you for spending some time and explaining that to us today, Adam. If there's any questions that might come in,
not tomorrow. Let's not.
Oh, sorry, Thursday. I'm adding to your burden there, aren't
exactly.
I?
Made you dropping a curveball at the last moment. No, Thursday, and we'll go live on Thursday, and it will be a stunning success as it is at Nottingham. So thank you.
Sure, I'm sure it will. If you just stick around, let's see if Mel rejoins us, or indeed we might have some more questions in the chat. So we have got some questions in the chat. They seem to be all directed your way, Debbie. So apologies, Debbie, I didn't bring you in earlier, but Debbie's our Deputy Director of People. We've had a couple of questions that I think you can help us with. So firstly, let's turn to the one around the RCN vote. Can you explain why Sherwood Forest Hospital's RCN members aren't striking? Because there's some misunderstanding around thinking that it was actually a national ballot, not one that was just specific to individual organisations.
Yes, thanks, Paul, and good afternoon, everybody. So in relation to the RCN ballot and the information that we've received from the RCN is while they were balloting nationally in England, Wales and Scotland, the ballot was applicable to individual organisations. And the information that we received, so nationally the RCN identified the results, I think it was on Wednesday afternoon, and in the media there was a published list of organisations that met the thresholds in which legally have to be met for industrial action to be taken legally. And Sherwood Forest Hospitals did not meet those thresholds, and therefore strike action will not be taking place from the RCN's perspective at Sherwood Forest Hospital. So I hope that answers that question.
Yeah, thanks, Debbie. And I might be showing some ignorance of the legislation, but the legislation talks about who's your employer, basically, is one of the key questions here, and we're all employed by our trust, basically, not by the NHS itself.
That's correct, Paul. Yes.
Brilliant, thank you. So further questions. Some people seem to take no pride in their attire since COVID when going into the office. So does the dress code policy not apply anymore? Well, it certainly does apply. There's a dress code and uniform policy, and that applies to all staff. So no relaxation since COVID. If there are any concerns, then please talk to your line manager if you've got concerns about that policy not being followed. So thanks, Debbie, for providing that. Is there anything you'd like to add?
No, I think that answers the question. Thanks, Paul.
Brilliant, thank you. And then a further question I'll come to you on, if I may, Debbie. The question is, if we are advised that there is no money left for overtime, but the work still needs doing, are we within our rights to refuse to work extra if this can only be paid back in lieu time, especially as it is hard to take annual leave due to the need for extra work?
Thanks, Paul. So a couple of points I'd really like to pick up on this. So our national terms and conditions are really clear in terms of individuals and the request for undertaking overtime and what payment looks like in terms of overtime. And if individuals are not paid for that, then lieu time can be paid back in plain time rate. What I would advise in this situation is that, again, a discussion should take place with the line manager or hire manager to understand the reasons why overtime is not being offered from a monetary perspective, and have those conversations at local level. It's not something that I've been made aware of, and then if there are any further questions, then they can be directed to the People Directorate.
Thanks, Debbie. I haven't got any questions, but we've been rejoined by Mel. Mel, welcome back. There is some irony, given that you're the digital midwife, that
I lost connection. I know, my computer decided to shut down. Yeah, sorry, at the vital moment. Sorry. Yes, I'm back.
But now you're back. Obviously,
yes, I'm back.
I think you heard most of Adam's intro. Is there anything that you would like to add about BadgerNet?
So I suppose it's just really to add, obviously we're going live on Thursday here. There's been lots of preparation with regard to training, and we have managed to train sort of 90% of our staff, which is really, really good. There have been additional training sessions put on for the whole of last week and for this week, and they'll remain actually tomorrow and Wednesday. So for any staff who feel that they want to access any additional training or have any one-to-one support, that they can access that. It's in the maternity training room, and we've got sandbox environments out in the clinical areas, so in antenatal clinic, on labour suite and the maternity ward, and over at Newark. So that's an opportunity for whatever shift you're on, if you want to have a little go and practice on test patients in the BadgerNet environment before we do go live on Thursday. Take that fabulous opportunity really to have a go before we go live. But yeah, there's lots of quick reference guides being shared to support staff as we go live, and there'll be lots of support out in the clinical areas. We've got a good support system in place, which I'm sure Adam may have spoken about and I might have missed it, but yeah, it's exciting. I think they're going to love it. You know, once everybody feels confident with it, it's going to be a really, really good system for both clinicians and our birthing people.
Brilliant, thank you. So I think we were while you missed us at the end of Adam's introduction, we were talking about how beneficial this is to women, but actually, you know, it gives us great data and information as well, and ensures that we keep our people safe.
Absolutely.
And there's lots and lots of support. So there's always a little bit of trepidation about implementing a new system, but lots of support out there for colleagues who are doing that this week.
Yeah.
And indeed into the next coming days and weeks as well.
Yep.
Brilliant. Thank you for persisting and rejoining us as well.
You're welcome.
I don't have any other questions in the chat, so I will draw today to a close. Thanks to Vicky, to Debbie, Adam and Mel for joining today. We've got into lots of areas there and still finished within the half an hour. So thank you for that. Lots of information and useful updates there. So thank you for joining today. To everyone joining me and the guys, thank you for joining us. Hope you found it useful. Many of the things we will return to in the coming weeks and keep you updated and supported. And in the meantime, we'll see you next week. Take care and keep safe. So see you again next week. Goodbye.
Bye-bye. Thank you.